Well, here we are, chapter 4, and in this chapter we're going to talk about communications and documentation. The majority of this chapter is actually going to focus on communication, which I'm kind of glad it does, because it seems like so many of us think we're really good at communicating, only to find out that we're actually pretty terrible at it. And I think a big part of that is, at least in today's more modern society, we now communicate by all kinds of electronic and digital means, and we're not doing a very good job of communicating with people in person. Sometimes we struggle with that, and it seems a little awkward or a little weird. So this is a pretty good chapter that will hit a lot of those points and give you some pointers and some tips on how to communicate effectively with people, not only just people face to face, but through different means and media and things that we use to communicate with, and not only verbal communication either. So we're going to talk about several things, and then we'll finish up talking a little bit about some documentation issues that you need to be aware of. Documentation there will be some other things that will be covered in relation to documentation as well by your instructor. He'll cover a few things as well. So, communication, of course, is the process of conveying information to another person, either verbally or through body language, which is nonverbal. Effective communication is crucial in the pre-hospital setting. It helps to build a positive relationship with patients and coworkers. Verbal communication skills also play a key role in this. They allow you to collect information from patients. They coordinate the efforts of all the responders present at the scene, and they're essential when handling or handing off patient care to hospital nurses and physicians. Documentation, on the other hand, is the written or electronically recorded part of the patient's permanent record. It shows that appropriate care was provided. Documentation tells the patient's story to others involved in that patient's future care. Accurate reporting and thorough records ensure a good, thorough continuity of patient care. Complete patient records also guarantee a proper transfer of responsibility to higher care or to other healthcare professionals. Good documentation also will help to comply with health department regulations and law enforcement requirements. Patient records also fulfill your organization's administrative needs, and this documentation also supports funding for further EMS research. So who knew documentation did so much for us? But also the reason why we have communication and documentation together is your written form of your report, whether it's handwritten or electronically done, is a form of communication, and it's also documentation. So the two do overlap. So written word is a form of communication. So it's important that the two are kind of brought in together. So the first thing, or one of the things we'll also talk about too, is computer, radio, and telephone communications. These are tools that we use in the EMS field to connect with other members of the EMS community, fire departments, as well as law enforcement while we're on duty. You need to know what your communication system can and cannot do, and it's important to use the system efficiently and effectively whenever you're using it. So the first thing we're going to talk about is this thing called therapeutic communication. This uses different verbal and nonverbal techniques and strategies. This helps to encourage patients to share their feelings, and it helps to build a positive relationship with each patient. So basically, it's kind of like communication through therapy, therapeutic communication. What we want to do is we want to communicate with our patients in a way that allows them or makes them feel comfortable with opening up and sharing more information with us. There's this, one of the models that your book talks about is this Shannon Weaver communication model. It's ironic that it's brought up in an EMS setting, but it makes sense, and I'll tell you why here in a minute. But this model was created in the 1940s to help understand communication mathematically by the telephone companies. It's kind of funny that the telephone companies wanted to understand communication better, but it really makes sense. That's where their bread and butter was. So this particular tool still remains useful today in understanding how humans communicate. And they do this in what essentially amounts to 5 different steps for effective communication. The first step in that is the sender, the person that's going to be sending out a message, starts with a thought. So they're thinking of something. They then encode that thought into a message. So sometimes, when you're thinking about something, you have to think about it for a minute of, okay, how am I going to say this? So that's the process of encoding it into a message, and they send it out. The message is sent then to the receiver receives that message, they decode the message, and then they send feedback back to the sender. So think of it this way. If you had back in World War II, they had different ways that they would communicate, but they were all high security, encoded, top secret communications. And if you didn't have, the Germans were really good at it, they had a machine that was called an Enigma machine. They would type the message into the Enigma machine and then send it, and it would be sent to another Enigma machine, and that Enigma machine you would get the message, or actually the message would come in, I think, in paper version or Morse code type version, and then you would take that message and type it into the machine, and the machine would decode it. So it's similar to that is how communication works in people. It's very similar, whereas we have a thought, we encode it. For this class, I'm encoding my thoughts into the English language, sending it out to you. It just so happens I'm sending it by video. You're going to receive that message. You'll decode it based on your knowledge of the English language. And then, if necessary, you'll send me some form of feedback. It's going to be a lot harder to do via video when you're watching a video, but it is possible. It's not, completely impossible. Think about this, though. The issues that we would have is, let's say the person encoding the message is encoding it in Mandarin, which is what the Chinese speak, and the person receiving that message is trying to decode it only knowing the French language. We're going to have a disconnect there. So, this model only just basically explains how the communication process works, not everything that goes into it. So you kind of see where that we could have a disconnect if we're not both using the same encoder decoder. And this is just a diagram that kind of gives us an idea of how that encoding message and decoding works, and the feedback loop that goes along with it. Some things that can kind of actually affect that, factors to consider during, with that, of course, are age, body language, clothing culture, education, posture, those kinds of things all come into play. For instance, you're going to be educated as an EMT, and as such, you're going to learn different words and terminology and phrases and those kinds of things, and they make you sound really, really smart, or really smartified. But the problem is if you try to use those big words with average people, they haven't been educated on those words, so they don't know them, and it's going to create a communication barrier. Remember what I just talked about, encoder versus decoder. If their decoder doesn't have the ability to decode the words that you're sending, the message isn't going to get through. We see similar issues that are age related, and as I get older, I see more and more of them, experience more and more of them myself. My generation had certain slang terms and words that it used, and the current generation has their own as well that are, for the most part, a mystery to me. Staying away from the modern vernacular of slang terms and those kinds of things that may be cool when you're hanging out, or maybe well received when you're hanging out with people your own age or of your generation, it just won't work with everybody. So those are some things that we need to, take into consideration when we're trying to communicate with somebody. Make sure that we're speaking in a universally understood language. And I get it, not everybody speaks English, and sometimes there's going to be some barriers that you'll have to overcome. But if everybody is speaking English, make sure you use terminology that people are going to understand. So age, culture, and personal experiences are also going to have a significant amount of impact and influence on how a person is going to communicate. Body language, eye contact can vary widely across cultures. Some cultures don't like direct eye contact, where other cultures actually expect that. Some cultures encourage expressing emotion, while others see it as a sign of weakness. And of course, in certain cultures, it's considered impolite to look away while someone is speaking or while you're speaking to someone else. So myself, I speak a lot when I'm talking using my hands. My hands are moving, which is very ironic because my younger brother is deaf and he only knows sign language. And when I'm talking, and I'm not necessarily talking directly to him, but when I'm talking, I get a little animated and I'm using my hands, he gets very frustrated with me because he's trying to figure out what I'm saying from across the room, and I'm not saying anything. But it distracts him because he's trying to decode what I'm saying, and I'm not even speaking the language. I'm not even trying to say anything. So there are some things to consider when we're communicating with others, as well as things like the tone, the pace, and the volume of how you speak gives clues about your mood and maybe even the mood of the person that's communicating back with you. These elements also show how important the person thinks the message is. Ethocentrism means placing your own culture's values above others. This is not uncommon, and we see this quite a bit, with younger people, in their, from children up into people into their 20s and sometimes early 30s, before they really have had a lot of experience with other cultures and understand things are different. To this point in life, oftentimes they've only ever been around cultures that are of their own or of their own similarity. That's not always the case. Some have been around some very diverse cultures at young ages, and they don't typically have that ethnocentrism trait, but sometimes even older adults will have that particular trait. So it's important to understand that, because people are often going to interpret messages through their own cultural lens or their own cultural perspective. This cultural imposition happens when you force your values onto others. So be aware of that in your communications, that there may be some cultural barriers or some cultural differences. Unfortunately, oftentimes healthcare providers wind up doing this unconsciously, because they believe they don't outwardly believe that their values are superior, but that's the only thing that they know, so that's what they're expressing in their communication. Some might even do it consciously. Some of them might believe that they're better than the person that they're communicating with for whatever reason, but oftentimes it happens unconsciously. We don't realize that we're doing that. Nonverbal communication is a big one. It is oftentimes more informative than the words that we're saying alone are. You should be able to sense a patient's mood without any words being exchanged. You can look at them, they got a frown, they're a scowly face, they look mad, probably are. So look for those facial expressions, their body language, whether or not they're making eye contact, because those are all powerful communication tools, and we can get a sense of what's going on with this patient or where their mood or mindset is just by watching them. It's important to pay attention to both your own and your patient's body language, though, so make sure that you're paying attention to your body language. It's when somebody tells you, if you've ever been told that you have a terrible poker face, what that means is whatever thoughts, feelings, or emotions you may have, other people see them without you expressing them. That's the thing that you really need to guard against. You need to try to hold those things back as much as you can and be very neutral about your with your communications, in your communications with other people. But these physical clues that your patients kind of give off, and some of your own, sometimes it's good to show some of those. These can help your patient understand the message that is being communicated. If your intent is you're like, hey, look, I'm here to help, you want to make sure that your body language and expressions are, hey, I'm here to help. Not, great, you got me out here in the middle of the night for nothing. Your voice is saying one thing, but your body language is saying another. So it's important to watch those or pay attention to those. What are the nonverbal cues that you're sending out there? When you're taking care of a hostile patient, it's important to be extremely or hyper aware of your body language. They're going to interpret that even if your body language is not intended to be a particular way. Sometimes they're going to interpret it differently, just because of their heightened state of emotions. So you want to try to make sure you stay calm and try to diffuse the situation. Don't take a hostile posture back, because that's just going to cause them to heighten their hostilities. Avoid assuming that aggressive posture. Maintain good eye contact, but don't stare. Look them in the eye, but then kind of look away and then look back, and speak calmly, confidently, and slowly. And of course, never threaten the patient with verbally or with physical harm or anything like that, because once you do that, you've lost them for good. They're not going to trust you. They're going to be highly skeptical of anything that you say or plan to do from that point forward. Physical factors can also affect communication. These things are going to include things like noise or anything that blocks or distorts the true meaning of the message. It's really easy for some words to sound like other words, and in a particular phrase or sentence they can get misconstrued or misinterpreted. I don't know if you've ever watched the YouTube videos called bad lip reading, where these guys and gals, they'll see these like NFL players or whatever on the sidelines, and they're talking, but you can't hear what they're saying, so they interpret them. They read lips and interpret what they're saying, and they always, it's meant to be funny. But in the absence of being able to get a clear, concise message, the message received could be garbled. It could be inaccurate and wrong. This can literally be noise. It can be lighting. It could be distance from the patient. It could be physical obstructions or objects in the way. Cultural norms often determine how much personal space people need during the communication phase. So different cultural norms are going to have a different impact on that. The closer you get, the more trust that you build. Your gestures, body movements, and attitude play a key role in earning the trust of patients and their family members. Verbal communication this is where it's at. This is what we do the most of, and it's a big key part of our role as EMTs. Asking patients questions is one of the most important tasks that we do. Open-ended questions encourage detailed responses, so use open-ended questions whenever possible. For example, instead of asking, are you feeling bad today? That would be a yes or a no question. That's a closed-ended question. What we want to ask is, what seems to be bothering you? That's not a question that they can answer yes or no to, and they're going to have to elaborate. This is when asking these types of questions are going to give us the most amount of information that we can possibly get from them. So these are the ideal types of questions to ask. Closed-ended questions are, like I mentioned, they're very short, so they're the yes or no answers. These are helpful, though, if patients are unable to give long answered questions. These are really helpful in those situations when we ask a question like, are you having trouble breathing? And they can say yes or nod their head without having to use the energy and the air that it takes to give you an answer or even a lengthy answer. But be careful, because remember, these closed-ended questions may miss some important details if you're not asking some more relevant or deeper questions. If you have a patient that you can't because they are having difficulty breathing, perhaps you can ask a family member or something along those lines. Or, tell the patient, hey, look, I'm going to ask you a couple of questions, but don't answer them verbally. Write them down or point to what I'm talking about, or use hand gestures, those kinds of things. Use some of those nonverbal tools that we have. There's a lot of tools that we can use to get information from our patients. Of course, facilitation encourages the patient to talk more and share more information. This is the preferred method. We try to get them to talk, but not every instance affords us that ability to be able to do that. So we have to maybe come up with some alternative plans as well. Another really good technique is pausing. Pausing, don't be afraid of those little bits of awkward silence where a patient may be trying to think about how they're going to respond. So a patient pausing or thinking about something for a short period of time is not that big of a deal. Give them that time to do that. Of course, reflection is when we restate what the patient said to confirm that we understand what they're telling us. So when they tell us something that either seems a little off whack or out of kilter, we might repeat what it is that they said and say, is that what you're telling me? And see if they can maybe clarify a little bit more so that you have a better understanding of what it is they're saying. Of course, empathy involves being sensitive to the patient's feelings and thoughts. So we should always be empathetic. Sometimes it is not easy. I'm just going to tell you, early on as an EMT, being empathetic is nice, patting hands and, speaking nice and all that stuff. But, after you've been doing this for a little while and it's, you've run call after call after call after call after call, and you get called to a nursing home where someone's got a hangnail and they want to go to the hospital, it's really, really hard to be empathetic. But you still have to be empathetic. It's important that you are empathetic. So, and then of course we have clarification, which is asking the patient to explain what they meant by their answer. So maybe we ask some follow-up questions. Confrontation helps focus a patient who is in denial or in shock, or uncaring about some urgent or life-threatening critical issue, something along those lines. Sometimes we have to get a little more confrontational to kind of get their attention. And of course, explanation provides factual information to support the conversation. And then, using the summary technique that kind of gives the patient an overview of what was discussed and the steps you're going to take. So kind of summing things up and say, okay, here's what you told me. This is what I understand that may be going on, and here's what I think we're going to begin doing right now and start the process of getting them on the road to feeling better. So those are some great communication techniques. However, when we're interviewing patients, we want to be careful with a few things. When we're interviewing a patient, use touch carefully to show that we are caring and compassionate. We're showing that empathy. But not everybody's going to be receptive of this. Not everybody's going to be comfortable with this. It's because they don't know you. They're not that, and others are it's going to cause them to completely relax and feel okay. So you want to use it cautiously and sparingly and kind of get a sense of how well that's being received. And just a gentle touch of the hand or grabbing a hold of somebody's hand or something along those lines. It's a little better received with the younger the patient. As the patients get older, it's a little less well received. If you do touch the patient, and we're talking appropriate touch, approach them slowly and touch their shoulder or arm respectfully, or consider holding their hand or something along those lines. Avoid touching the torso, chest, face, just to communicate, as these areas are often considered intimate areas, and that kind of touch will not be well received. Here are the interview techniques to avoid. Some things to just don't do these things. Avoid using false assurances or reassurance. Oh, everything's going to be fine. We'll be able to sew that arm right back on there and it'll be just as good as new. Don't give them false reassurances. Don't give them reassurances that you are not able to deliver on yourself personally. So if you're not a orthopedic surgeon that can reattach somebody's arm, don't give them any kind of reassurances that everything's going to be okay, because you are in zero control of that. So be very careful with false assurances or reassurances. Don't give unsolicited advice. So don't give them advice on something that they're not asking advice for. You know, don't say, hey, look, I think you ought to dump that no good, lousy so-and-so that just beat the snot out of you. They're not asking for that advice, so don't give it to them. Avoid asking leading or biased questions. Those types of questions rarely get you the information that you need. While it may lead them in a direction, but because the questions are typically biased, you don't really ever know if the information that you're getting is completely accurate. Try not to talk too much. Try to talk less and listen more. Sometimes this is a struggle for some of us, and I'm pointing at myself right now. You can't see me doing that. But avoid talking too much in those situations and allow the patient to talk more. However, sometimes you'll get some of them patients, you're going to get them started talking and they won't stop until you drop them off at the hospital, and when you leave, you'll still hear them talking to the staff. Avoid interrupting the patient unless it is absolutely necessary, or interrupting family members. They typically don't respond well to this. Sometimes though, in certain circumstances, very emergent circumstances, sometimes you do need to interrupt them, because you're just like, okay, hang on, I need to know this. And then you kind of move on from there. But realize when you interrupt them in that way, oftentimes patients have a tendency to kind of shut down a little bit, because they were starting to open up to you, and now you're telling them, don't open up to me. That's the underlying message that you're sending when you interrupt them. Avoid using why questions. Why questions oftentimes place a, kind of the feeling of, I'm being accused of something. Well, why did you do that? Why did you do this? Why did that happen? Why, when you're asking that, you're almost giving a condescending impression to the patient, like you're going, why did you do that? So avoid those why questions. Avoid using, heavily authoritative language, and we talked about using, professional jargon and professional, those big $10 words that you're going to learn in the EMT class. So we want to avoid using those words with your patient. It's okay to use it with other healthcare providers, just not with your patient, because they're not going to understand what you're saying. So when it comes to family members, friends, and bystanders, they may actually be a very valuable part of the process during the patient interview. But be sure to allow the patient to answer if he or she is available to, or able to, and wants to, even if well-meaning family members are attempting to answer the questions for the individual. So we want to hear from the patient. The patient is the primary and the most important person there. Sometimes though, the patient will answer, and you'll have a family member go, actually, the patient may say something along the lines of, yeah, I took my medicine about an hour ago. And the family goes, actually, it was about 12 hours ago. So sometimes family members are going to be able to provide some good information, in a follow-up to the patient, but we really want to hear from the patient. Don't be afraid to ask others to step aside for a moment while you talk to the patient. It's completely appropriate, depending on the situation, that you clear the room. Family members and everybody say, I need to talk to this patient alone. They may or may not comply, but it is not inappropriate to ask them to do that. If you can't, or if you don't feel comfortable doing that, or if you don't think that's going to be well received, just ask those questions once you get them in the back of the ambulance alone, and don't let the family ride with you. That's always an easy solution. You may need to decide if having a family or friend nearby is helping or hindering the process. So sometimes having a family step away for a few minutes so you can kind of get control of things, and let the patient know that, hey, I'm here now, I got you, we're going to take care of you, we got this. And then letting the family member come back kind of has everything smoothed out, and makes things go a whole lot easier. Golden rules: The golden rules to help calm and reassure a patient are things like making and keeping eye contact at all times, providing your name to use and using the patient's proper name. One of the main things that I always did is I would walk in the door of somebody's house and I would walk right up. I'd be like, okay, who are we here for? Because sometimes it wasn't always clear, and you never make assumptions that the person sitting over in the corner looking like they're about to die is your patient, because I've been fooled by that before. It just so happens to not be your patient. But ask who the patient is. Once you know who the patient is, walk over to the patient and stick your hand out and say, hey, hey, I'm Rusty. I'm your paramedic I'm your paramedic today. What's going on? And they tell you what their name is, and you start that relationship with them. So using their proper name is really helpful. Avoid things like honey, baby, sweetie, darling, all those kinds of things like that. I'll be honest with you, anytime anybody ever says something uses one of those terms to me, makes my skin crawl just a bit, because I'm always thinking, you don't know me well enough to use those kinds of terms with me. And I believe a lot of people are that way as well. So use their name. If they say, my name is whatever, but everybody calls me Granny or whatever, then that's okay for you to use those pet names if they give you permission to do so. Tell the patient the truth. Be honest with them. Don't give them false or misleading information. Use that language. Remember the language that they can understand. Be careful what you say about the patient to others. Remember, they're family members or friends or that kind of thing. So be cautious about that, and just be aware of your body language. What message are you sending? What non-verbal messages are you sending to the patient, the family, and everybody else? If they're honest and open, friendly gestures, it's fine. But if you're frustrated, upset, worried, whatever, about the last call that you just finished up, that could carry over into the next call, and just make sure your body language is reflecting that, so you're not sending a mixed message or a confusing message to the patient or their family. Talk at a moderate pace, pronouncing your words clearly and carefully so that everybody can understand them. And when communicating with the patient who has hearing difficulties, make sure you face them so they can see your mouth moving. Sometimes they may not necessarily be reading lips, but sometimes them seeing your mouth moving helps them to understand the words. They're hearing the word and they think it's this versus that, but seeing your mouth move, they're like, oh, it's clearly that, not the other word I thought it was. Give the patient enough time to think and reply to your questions. And then, of course, maintain a calm and self-assured tone and behavior when speaking to your patients. This is something that can be difficult when it's your first, 10 or 20 patients that you're ever involved with. Speaking in a calm manner can be a little tricky. Your voice shakes and you're nervous and those kinds of things. Sometimes your patient is less nervous than you are, and it shows. So as an EMT, you'll learn to overcome those things. We'll do some things in the classroom and in the lab, some skills and some things like that, and some scenarios that you'll go through to make that process be a whole lot smoother. But still, at times, it will be a little bit nerve-wracking, but try to stay calm. So, emotional intelligence. Emotional intelligence is a skill. It's actually a skill to recognize and control your own feelings while appropriately reacting to the emotions of others. This ability actually aids in resolving conflicts, establishing trust, improving communications, and handling challenging circumstances. This is one of the things that it's kind of like critical thinking skills and some other things like that. Not everybody comes into healthcare, whether it's the EMT program or even a paramedic program, with a high level of emotional intelligence. This is something that we develop over time and over interactions with other people, but it is a critical skill to learn and to hone and get really good at, so that you can utilize your high level of emotional intelligence to your benefit when you're taking care of patients. So Some attributes of this are, of course, self-awareness means being conscious of your emotions and how they influence your own thoughts and behavior. Self-regulation is going to involve controlling impulsive reactions and channeling emotions in a much more healthy manner. Motivation refers to encouraging yourself and others to pursue constructive objectives. And empathy, which is a big one, is the capacity to grasp others' feelings, worries, and needs by interpreting social and communication clues. Social skills are the ability to create and maintain positive connections through effective and clear communications. So these are all attributes of emotional intelligence. Big ones in these are self-awareness, self-regulation, and empathy. Those are the three big ones, and I'm not saying the other two, motivation and social skills, are not important. The main three in here that are most important are those three that I just mentioned. Self-awareness, being conscious of our own emotions and how they're going to influence our thoughts and behavior. If you've ever been just really, really mad and upset going into a conversation with somebody because somebody else told you something that they said, and you go into that conversation frustrated, angry, upset, whatever it is, but you hold those emotions in check until you have some confirmation that that person actually said that or meant it or whatever. You hold those things in check. That's showing a high degree of emotional intelligence. You're like, that person didn't actually say that to me. Somebody else told me that they said that, and it's made me really seethingly mad. But you hold your anger and frustrations back, and you don't let them show. You consciously hold them back and don't let them show, because you want to find out if that's true or not. Oftentimes in those situations, we find out that it's not true. When we're younger, we find out that it's not true, but by the time we find out it's not true, we've made a complete and total horse's rear end out of ourselves because we let our emotions run wild and run roughshod over the situation rather than keeping things in check. So self-awareness, self-regulation, controlling those reactions and those kinds of things. And sometimes, the self-regulation side of thing has to do with somebody calls, let's say you're 4 calls deep and people have been waiting for the ambulance to arrive at their house, and when you pull up to the house, the husband of the patient is extremely upset because it has taken you so long to get there, and he's using all kinds of foul language, asking where have you been, and all kinds of things like that. He's very upset and very animated. Your ability to self-regulate your emotions and go and reply in a respectful, emotionally controlled manner will help diffuse that situation by explaining, and being apologetic. That's where the empathy role comes in, and saying, I'm really sorry, but we've had multiple calls going on at the same time. This is our 3rd or 4th call in a row. We were trying to get here as fast as we could. Let us get in there and let's get her taken care of so we can get her on the road to recovery. That is going to completely diffuse that situation, and that's why emotional intelligence is so important in EMS. And rather than elevate and escalate things by responding back in kind, saying, repeating or, responding to this angry husband using other foul language or those kinds of things, or, nonverbal cues that make it seem more threatening. It's important to use our emotional intelligence to help to regulate those things. So begin to pay attention to the ways that you can improve your emotional intelligence. Is start to pay attention to how you respond to those stressful events. Control the irritations that you feel, and strive to remain composed and balanced when encountering those small annoyances. Kind of like critical thinking, your critical thinking ability, your emotional intelligence is something that's going to evolve and grow over time, but it's like any other skill. It's like a muscle that you need to develop. In order for it to work well and be ready at a moment's notice, you need to exercise it. You need to practice it. So start paying attention to stressful events and be mindful of how you respond to those. You can do that, you can cultivate that mindfulness by concentrating on the here and now without criticizing yourself and others. And then, of course, when reflecting on how you did in a particular situation, own up to your behaviors and the decisions that you made. Take responsibility for your actions. And then reflect on the impact your behavior may have had on those around you in that particular situation. All of these things are going to help to contribute to improving your overall emotional intelligence. The behavioral change stairway model was created by the FBI for handling hostage crisis situations, and it was later applied to various emergency scenario types of situations. And the way that this worked was, and this was a form of emotional intelligence, but yet a way to handle a particular situation and to work a person through a crisis. So what you want to do is you want to practice active listening. When they're talking, you need to be listening, actually listening to what they're saying. Display empathy. Show them that you're empathetic. It's okay to say, "Man, I'm really sorry this is happening to you today. Let's start working on how we can fix this, how we can get through this." And you want to establish that connection. And then maybe apply some of the influence that you may have. Exert your influence a little bit, by, maybe your training and that kind of thing that you have. They're like, "Oh, I'm going to die," or whatever. It's like, hang on now. That's why I'm here. I'm here to keep that from happening. That's my goal, is to stop that from happening. So let's stop with that negative talk. Don't talk like that anymore. I don't want to hear any negative talk. Only positive talk from here on out. So you kind of exert your influence on them by getting them, but it's like, "Hey, whoa, hang on, look, we're not going that route. This is what we're going to do." And then, kind of like I was doing as well, is initiating that and encouraging that behavioral change in them. Changing that mindset, is going to be really, really helpful. But this model was actually developed by the FBI for hostage situations. So you can say, "Hey, I use the hostage situation model to diffuse situations." So when we begin that communication with our patients, we're going to introduce ourselves clearly, show that you're skilled, confident, and compassionate, and avoid assuming that elderly patients are forgetful, disoriented, or deaf. So don't make assumptions. Don't think somebody is senile or confused just because they have gray on the top of their head and a few wrinkles on their skin. You might face anger, impatience, or confusion. Don't consider these as typical behaviors. Check for indicators such as low oxygen, stroke, drug overdose, infection, maybe even low or high blood sugar, or even poor blood flow. When we get into talking about these particular issues that people may suffer from, it'll make a whole lot more sense why somebody might present as irritable, confused, or even hostile, and it may be a medical condition and not necessarily that they're just a jerk. Move toward the elderly patient gently, without rushing, no fast movements. And of course, give the patient ample time to answer your questions. Make sure they understand what you're asking them and give them time to answer. Don't rush them through things. Elderly people do not like being rushed through anything. I really think that once somebody gets to the point that they're retired, everything in their life kind of slows down a little bit. So they don't want to be rushed. They're not in a hurry anymore. They've been through the hustle and bustle, and now they want to, rest and relax a little bit more. Look out for symptoms of disorientation, nervousness, or difficulties with hearing or sight, and ensure the patient trusts that you're managing the situation and doing everything you can do to help. Remain patient throughout the interaction with that patient. It's kind of weird, remain patient with the patient. But that's what we're going to do. Remain patient. This can really be difficult in those instances where you have other calls waiting and you're trying to hurry, trying to move through that situation, but it's still important that the patient that you're dealing with feels important and they feel valued. That way they'll continue to communicate with you and let you know what's going on. But you can kind of speed things up a little bit. while still being patient with them in those instances. But if you don't have a reason to be rushed or in a hurry, don't rush. Be patient. Take your time. Older adults frequently experience less pain sensations. It seems kind of counterintuitive, but generally speaking, older people don't feel pain as much as younger. They might not fully notice significant alterations in their bodily functions, and they're going to require you to be particularly alert and to those observable changes. So you're going to have to pay a lot more attention with our older adults, because some of their sensations don't work quite as well as they used to. And I think maybe in the next chapter or the chapter after that one, we're going to talk about how the body grows and develops from birth to, all the way to death. And we'll talk about that and some of the changes that the body goes through. And perhaps some of this will make a little bit more sense. Whenever you can, allow the patient some time to gather a few personal belongings before you transport them to the hospital. Make sure you find hearing aids, glasses, dentures, those kinds of things, those support aids that they may need. Older patients frequently worry about security of their homes, valuables, pets, those kinds of things. So, help make sure that the place is locked up. Maybe that pets are put in a particular area, maybe even that they have food and water before you leave. Communicate these worries to the individual who will be caring for the patient at the hospital. That way they can relay that to family members that may be able to go over and take care of pets and make sure those things are done. When it comes to children, fear tends to be very noticeable and intense with them. Children might feel scared by your uniform, the ambulance, or even a large group of people surrounding them. If you want to know the one main thing that children are worried about when it comes to EMTs and ambulances and doctors, nurses, and all that kind of thing is, I bet every one of you already know, it is the fear of a needle. They are terrified that they're going to get a shot. And, of course, as we get older, we realize there are a lot worse things in the world than a shot. But when you're a 5-year-old kid, to them, there is no worse thing than a shot. So be honest with them and realize what those fears are. So it's also helpful if they've got a doll or a beloved toy or a comfort blanket that they want to hang on to, allow them to bring that with them or hang on to it. Whenever possible, have a family member, a close friend, ride along with them. If feasible, let the parent or guardian stay with the child during the assessment and care phase, and maybe even during the transport phase. Not all services allow for family members to ride in the ambulance, so that may be a little different call depending on where you work. Always be truthful, because children, they are really, really good at sniffing out dishonesty, and they will call you out on it. Unlike an older adult that might just look past it, children will call you out on your dishonesty. Warn them in advance if they're going to experience any pain. You would think we would not want to do that because we would not want them to get anxious about it. But if you don't tell them something's going to hurt, they're never going to trust you again. So you need to be completely honest with them. Honor their privacy and their dignity and those kinds of things. Protect their modesty at all ages, no matter what. You're a stranger to them. They don't know you. So keep that in mind. And that's another reason why it's helpful to have a family there with them when you're doing your assessment. Communicate professionally while remaining approachable and warm. Choose your tone and words carefully to suit the child's age. Again, we're going to use a language that they're going to understand. We're going to speak in terms they can understand. Keep good eye contact with them. And of course, it's very helpful to get down on their level when speaking to them. And always avoid standing or towering over them, because that puts you in a very high position of authority over them. And oftentimes this causes the pediatric patient to kind of clam up. It scares them, when you're towering over them. So get down on their level so that they see you more as an equal, as opposed to someone in great authority over them. So oftentimes we would communicate with patients that have some form of hearing impairment. Communicating with patients who have hearing impairment is pretty common. They quite often have normal cognitive abilities and generally don't feel ashamed about their condition because they've dealt with this for some time. Make sure you face the patient directly so they can read your lips if they're able to. But again, like I mentioned earlier, sometimes them being able to see your mouth move, they can interpret you a whole lot better. Take care that hearing devices are not misplaced during incidents or falls, that kind of thing. Or when you're transporting them, make sure that they go with the patient. Confused patients may forget to use their hearing aids. And of course, check with family members regarding the patient's use of hearing aids. We might ask a family, do they normally wear hearing aids? So that we can maybe pop those things in and they can hear us a little bit better. And it's not just elderly people that have hearing aids. And then there's some people that are deaf that hearing aids do no good, or they don't have hearing aid. The typical in the ear hearing aid doesn't work, and they only speak by sign language. So we sometimes have to deal with that. Effective ways to communicate with a patient who has hearing difficulties could be using a pen and paper to write messages. If the patient reads lips, of course, that would be really, really helpful, and you need to make sure you're facing them when you speak to them, and speaking at a moderate pace. Don't speak really slowly, because that's very unusual facial movements for them to try to interpret. So just speak at a moderate pace. Don't speak super fast, but speak at a moderate pace so that they can read and interpret what you're saying. Avoid shouting at all times. Don't just speak louder because they can't hear you. That is pretty degrading and humiliating for someone that has hearing issues. So pay close attention and use brief questions to respond with concise answers. It's helpful if you can familiarize yourself with some basic sign language expressions, and knowing signs for a word like sick, hurt, help, and those kinds of things might be helpful, and you can see those here on your screen. But I'm just going to warn you, if you use a couple of signs to someone that fluently speaks sign language and they don't speak verbally, get ready, because they're going to inundate you with all kinds of signs, and they're going to overwhelm you. And you're going to be surprised at how fast someone can speak in sign language, and if you're not ready for it, it'll be really hard to keep up with them. So in those instances, when you have someone that does sign, you're going to have to tell them slow down, or write things down so that you can understand them. So when it comes to visually impaired patients, find out whether they have any vision at all. Patients with impairments might not be totally blind, and they may still detect light, shadows, movement, or they may be able to see things that are up close. It's just things farther away they have a whole lot of trouble with. Assume the patient has normal cognitive abilities, because most of them actually do. Describe each action you take as you perform it. So make sure that they know what you're doing. It's important that you communicate with them. I mean, literally going, okay, I'm gonna touch your left arm. And I'm going to do this, and we're going to do that. It's really important that you're very clear about the steps that you're taking with them. Maintain physical contact with the patient as you start providing care. If the patient is able to walk to the ambulance, have them place their hand on your arm or your shoulder and allow them to walk next to you and guide them to the ambulance. Ensure that if they have mobility aids like canes and those kinds of things, that they're transported with the patient to the hospital, because they're going to need them at the hospital at some point in time. So you might as well transport them with them when you go. Guide dogs are easily identified by their special harness that they make. Of course, you can buy those harnesses anywhere online. So, a lot of people will buy those and stick them on their dog. Not necessarily, seeing eye dogs, but they'll stick them on some, for support and that kind of stuff. So, but they're typically identified by the harness that they wear. If possible, bring the dog with the patient. We should not see the dog as an animal like we would most other pets in the house, this dog is a tool that is used by that person. And this is true of those, the support dogs, true support dogs that are trained for support, because some of them, know when someone's fixing to have a seizure, or those kinds of things, or their blood sugar is low. Those pets should be transported with the patient whenever possible. This is going to help to reduce the stress of both the patient and the dog, as these dogs are typically trained to stay close to their owners, so the dog will stress out as well. If transporting the dog with the patient isn't possible, arrange for care for the dog. A conscious patient can provide information and instructions about the dog's care, so we can kind of fall back on what they say we need to do. More and more we're coming across patients that are non-English speaking, and it's not any one particular language. It's multiple different languages that we're seeing, but they're just simply non-English speaking. So you still must obtain a medical history, even if the patient doesn't speak English. This step can't be skipped. We also have to get permission to treat them. We have to get consent from them, even if they don't speak English. When you come across somebody, for instance, that speaks a combination of Spanish and Kickapoo Indian, it is difficult not only for you to communicate with them, but their family members as well to communicate with them. So the language barriers could be difficult, and you're going to have to utilize others sometimes to help you. Find out if the patient knows a few English words or phrases that might be helpful. Use short, very simple questions. And of course, you can point to parts of the body to aid in that communication. Have a family member or friend, like I said, help to interpret language until a professional interpreter becomes available. And I'll be honest with you, if they're speaking a Spanish and Kickapoo combination, it's going to be hard to find someone that can interpret that. You just never know what you're going to run into sometimes out there. Also, if there's a common language in your particular area, like Spanish or something like that, it may be helpful to learn some common phrases in that language, or even other languages that might be common to your area. Pocket cards that show the pronunciation of terms are available. There's a lot of smartphone apps out there as well, and websites that might be able to help you translate some of that. But be careful with those, because some of them are not always accurate, and they may not be asking what you think they're asking. And if your patient's giving you a very confused look, you might know why. Or if the answer that is being translated from your smartphone makes absolutely no sense, then your app's probably not that great. Remember, you can always request that translator at the hospital. All right, so an hour into chapter 4, and that is the end of part 1. We'll be back for part 2. Part 2 will be roughly about the same length, and then we'll finish that out. We still got a little bit more to talk about when it comes to communication, and then we'll round out the chapter with some information about documentation, which is ironically another form of communication. Okay, so I will see you guys back at part 2.